Good afternoon, everyone. In this webinar, we're going to talk about frequent asked questions. These questions were proposed by the Patients Association and some of the members of the executive committee and the working group of knowledge management and gave the answer to these questions. When you have the patient in front of you in the clinic, is easy to explain, or is at least easier to explain, because you know the face of the patients and the family, and you know that if they are understanding or not, if they have more questions. So it's very difficult to summarize all this information without the input of the patient. So we just decided to try to summarize the most frequent answers that we gave in the clinic. So I'm not going to read in detail all of them, just to show the questions. I will want all of you to read this document and make proposal as soon as possible, please. What is a transplant? Of course, this needs to be the first question. So it's an operation in which a healthy organ or tissue of a donor is implanted into a person or recipient that has an irreversible malfunction of the organ. So here we introduce the concept of irreversible, that this is not, when you go to a transplant, this is not something that you can avoid. But we didn't want to go into a further definition in detail. It's just a summary. Who needs a transplant? A transplant is needed, again, by a person with permanent and irreversible damage to an organ or tissues. Why? Because it causes disability, reduces the quality of life, and may cause death also. The purpose of the transplant, going into more detail, is to recover the function of the organ, to improve quality of life, reduce hospitalization, and just a summary of the benefit of the transplant. Who has access to a transplant? We are increasing the text here for these questions. People with irreversible and permanent damage in one of his organs or tissues that have no alternative to medical or surgical treatment. So this is interesting to introduce that there is no alternative to transplantation usually. In that case, transplant is the only solution to avoid death or to bring to a better quality of life. It's also important to introduce this question because many transplants are performed because of quality of life reasons and not because of risk of immediate death. This person must undergo a rigorous study that would be evaluated by a group of specialists and meet the criteria established by international scientific societies. So this is just to say that this is not a local decision whether you are going to have a transplant or not. This do not depend on the center that you visit or that you are treated in, if you are going to go to a transplant or not. Indications are mostly universal. The process of donation is always altruistic, confidential, and regulated. Well, this is true for, I think, in all Europe, but probably we will need to introduce here that sometimes you can go also to a living donor. The problems that are expected to appear after transplantation, rejection of course, and the consequences of rejection. We are giving some more details in later questions. That's why this is so summarized. Piercing and tattooing. This was one of the hot topics when we meet with patient associations, especially children when they grow up, when they become adolescents, are very interested in this issue, and it's one of the most frequent questions that they have for us. Probably we don't have a consensus even among us regarding piercing and tattooing. Most of us are not in favor of doing such things because of the risk of infection, but at the end of the day, they really want it. So if we want them to have a normal life, to be normal people, we probably should allow them to have it. Piercing and tattooing requires an injury to the skin, so it is not recommended to encourage them in transplanted patients because of the risk of infection. But if the patient decides to get them despite the warning, it should be with prior knowledge of their group of physicians and should be done, of course, with certified professional using sterile and disposable material. How long will the transplant last? Well, this is a very frequent question, but it's complicated to answer because probably we need to go by organ, and then we are going to have to give a very long response. We have here kidney and liver, but we need to add the information regarding heart, lung, and intestine. If some of you are can volunteer for that, please go ahead. But probably we will need to reduce the question if we are going to include all organs. What are the immunosuppressive medicine? Of course, this is one very important frequent question. What is that? Because people are aware of medicine, of insulin, of medicine for hypertension and antibiotics, but it's very difficult to understand for them the first time what is immunosuppression and the consequences of having immunosuppression. So this is just a summary of what is it, immunosuppression. And this question is also regarding immunosuppression, why it avoids rejection, the way it works. I think it's well summarized, and there is no much to say about that. And finally, the last question regarding medication, will I need to have medication for all my life? Well, this is also a question for physicians because many of us would like to drop immunosuppression eventually at some point, but in children we know all that it is very, very difficult to have it, and you reduce immunosuppression usually when you really need to reduce it because of PTLD infection or whatever. But just in this answer, we have a summary of how medication will change in time. The effects or side effects of immunosuppression, infection, tumor, etc., and also another side effects like hypertension, diabetes, diarrhea, neurological problems. I don't think we should go into more details here or to provide a very long list of side effects or by each type of immunosuppression. And this is a also very important question from parents to us. Many of them don't want us to talk directly the first time to their child, and they want to explain themselves at home. So they want to know how can I explain my son, daughter that she or he needs a transplant. Then the message should be simple, adapted to the age and previous child experiences with the illness, and they should have the opportunity to ask questions. If they are old enough, of course, they will have a lot of questions, and so we shouldn't give them a long speech about transplantation, and it is more about giving them the opportunity to ask. They usually understand quite well that some piece of the body, an organ, is sick and it needs to be replaced. Many of them want to know about where the organ comes from. And then we have a very good opportunity to tell them and to explain them about the process of cadaveric donation and living donation, if that is the case. And we would emphasize the generosity and the positive experience of sharing life, because this positive philosophy around transplantation would be very important for them for their life. Before transplantation, the family will need some visits or even to stay for a while at the hospital. Then, especially for small children, it is very important to explain to kids that they will meet many children with similar problems and they are going to have specialized staff people that will take care of them, not just physicians, nurses, but also people who is taking care of their activities, games, etc. Who may be a candidate for a transplant? This is more for parents than for kids. It can be indicated in cases again of irreversible organ failure when conservative treatment are exhausted or are not available, because we have a replacement organ replacement for devices for some organs, but other organs don't have any replacement. The solid organ that can be currently transplanted in children are a list, of course, of organs, and of course they can have the indication for transplantation, but also can have contraindication. It is important to know, to let them know here. How a transplant is developed. We just try to summarize here the process of transplantation. From when you are at home, you receive the call in the middle of the night, you have to travel to the hospital with your family, and then what happened in the hospital. A very quick preparation, and then they go into the operating room. So again, this is a very short explanation, but I think that the main topics are covered by the answer. How long will the surgery take? It's a very difficult thing to summarize, because it's very variable from organ and from patient to patient. Depends on the organ and the previous surgical procedures. Generally speaking, an organ transplant lasts from 4 to 8 hours, but we all know that it can be about 12 or 14 hours in some cases of retransplantation, and depends on the organ. So I think it's a very summarized response and answer, but it's realistic to say that it's from 4 to 8 hours, and the retransplantation take a little bit longer. Of course, we can't change the hour if the experience in your center is different, or you want to emphasize that some organs are taking longer than other ones, but we wouldn't like really to go organ by organ. What are the main risks that we face in transplant? This is related to the procedure. We are not talking about the infection, immunosuppression, drugs, etc. It's about the procedure. So I think it's enough talking about the cardiac arrest and bleeding. That are the main complications that the patient can have in the operating room. And will the transplant affect the reproductive system? Yes. This is not a very common issue when we transplant kids, but the kids will fortunately grow up, and they will have this concern. And this is one concern that usually the parents have when they come to the clinic and talk to us. So yes, of course, a transplanted kid, a transplanted adolescent, and an adult can have can have a reproductive problem from previous disease. But the thing is that after transplantation, the reproductive system can work well again. Actually, it's a very important thing to tell them that they have to use contraceptive measures if they have relations, if they have sexual relations, because they can have a baby, they can get pregnant or have a baby in cases of males. So it is important to tell them in the positive way that they will be able to have children, and also as an advice that they have to use these contraceptive measures. And the last important thing about the reproductive system for girls is that some of the drugs that they are having for immunosuppression have to be removed even weeks before getting pregnant. It is not enough to interrupt them when they know that they are pregnant. They have to be removed weeks earlier because they can be toxic or teratogenous for the babies. Expectations. Well, we usually tell patients that they can have a normal life because we think that if they can play sport, if they can go out and they can go to school, they have a normal life. But this is a very personal concept about normal life. So we have to be honest and tell the family what the kids will be able to do, what activities. Mm, but probably it's not fair to tell them that they are going to have a normal life because in some cases they have to go for the hospital like once a month or twice a month, and then they consider that this is not normal life. So that's why we decided to tell them that you can expect your child to have an almost normal life, and then we will discuss about the concept of normal life. Well, I think this is enough for frequent asked questions. This is still a work in process. We need to also we still need some English edition, and we have to because questions come from different participants, so we need some English edition, and also we have to adapt the length of some of the responses. We have very short and some longer responses, and we still have some missing information. But the most important thing probably is if you agree with these questions, or if you think that some of them are not well focused, if you have some suggestion for new questions. So this is all for today. Thank you very much for participating.